Hopefully this is a mutual decision and we've come to this together as a patient and a physician and have decided that this is the best option for your sexual health. The procedure is performed in the operating room, and it can be done under a regional block or what's called a spinal anesthetic with IV sedation, or it could be done under a general anesthetic. And once you're asleep, we do also use some local anesthetic depending on where the incision is or the surgical approach. And then we take the appropriate steps, measure the gentleman, make sure we have the right prosthesis, make sure everything is perfect. And once we're perfect, we go ahead and close up, usually dissolvable absorbable sutures, maybe some glue, and sometimes we'll even use staples. Some patients will have catheters in their bladder. Most patients also have a drain coming out their side. And we wake you up and get you to the recovery room. The penile implant can be done as an outpatient procedure or a 23-hour stay. Some patients do go home the day of the procedure, later that day, of course. Some patients will spend the night. We do require that patients be cleared by their primary care physician. We do want the okay for surgery. And occasionally that does include cardiac clearance. Of course, this is not a surprise if that's a big cause for the erectile dysfunction or for the problem. Some patients, they do need pulmonary clearance and they have difficulties breathing. So occasionally patients will need to see a few physicians before surgery, but yes, everybody does need a visit with their primary to make sure they're fit for surgery and the procedure. We really do want you to have transportation. You should arrange for transportation home from the hospital, whether it's an outpatient procedure and you go home the same day or the day following if you spend the night in the hospital. We do give you a list of instructions before surgery. And this does include preoperative washing with Hibiclens soap. We do have you go buy a nice bottle of Hibiclens soap. You'll use it preoperatively as well as postoperatively. Some patients do use a vacuum erection device before surgery. They use it for penile rehab and sexual activity. We generally want you to avoid that for a good week or so before surgery. We don't want to injure or hurt the penis. Same things with injections in the penis or penile urethral suppositories. We really want to avoid injuring the penis in any way. So we'll hold off on those for a good week or two before surgery. We do have a list of medications that we have patients stop or discontinue before surgery. And generally this includes blood thinners or anticoagulants, and each one's just a little bit different on the exact length of time. There are some other medications that will need to be held or adjusted, and generally these can be things like diabetic medications or heart medications. But we will direct you. We always go through everybody's medicine list and do this appropriately. Unfortunately, there will be some eating and drinking restrictions with the surgical procedure. It does depend on what time of day the procedure is, and it depends on what kind of anesthetic you're going to have for the procedure. We also like to try and avoid alcohol for at least a good week or so before the procedure, and we'd like to try and stop smoking or decrease smoking before an implant surgery. You do need to bring some comfortable clothes to the hospital. Of course, while you're in the hospital, you'll be wearing the hospital clothes, but we're thinking about discharge. And at the time of discharge, we would like some compression shorts or maybe some tighter boxer briefs. But really, I don't want boxers or loose pants, but I also don't want anything that's overly tight. Other than that, just whatever's comfortable and appropriate. We really don't want patients to shave before surgery, as it can be an infection risk. So we do take care of that during the time of the procedure. The hospital will ask you to arrive a couple of hours early to the procedure. Then, of course, they'll check you in through the front desk, bringing you up to the preoperative area. You do get asked a lot of questions when they check you in, questions at the preoperative area. And they can be a little bit repetitive, but it's all very important. The preoperative nurse is the one that really gets you ready for surgery. Anesthesia will come by and talk to you. Of course, they'll talk to you about the anesthetic that you choose, the risk associated with such. Then we'll get you back to surgery. After surgery, you'll go to a post-operative area, and it's usually it's a different nurse, another nurse there taking care of you as you come out of anesthesia. Once everything looks good, including your vitals, you're comfortable, pain's controlled, and whatnot, then we do typically get you to the floor where 4 nurses will take care of you. Some patients are discharged home at this point, and of course we give you the appropriate discharge instructions. It is natural to be nervous before any surgical procedure, and I would encourage you to make sure you have all of your questions answered and you feel like you're appropriately educated. We do have a patient educator that you can talk to, very willing to talk anytime over the phone or even, I believe, in person. And of course, here at the office, we have a lot of resources for patients, and we're here, and we'd want you to call us and talk to me as well. It's important to me that you have every question answered before surgery and you're ready for surgery. I would like you to call us and let us know if you have any questions, anything that you could be thinking about. Please give us a call.